She was the punchline of the ER, the clumsy new nurse everyone mocked. They thought she was just a naive rookie who couldn't handle the blood or the pressure. That is, until the hospital windows rattled, a heavily armed Navy helicopter touched down, and a frantic pilot demanded her by name. The fluorescent lights of Seattle's St. Jude Memorial Hospital always seemed to hum with a manic, abrasive energy. It was a Level 1 trauma center, a place where miracles and tragedies were minted in equal measure every hour of the day. To survive the ER here, you needed skin thicker than Kevlar and an ego to match. Bridget Sawyer seemingly had neither. At 28, Bridget looked fresh out of a suburban nursing program. She was petite, soft-spoken, and had a habit of keeping her eyes glued to the scuffed linoleum floor when the senior staff barked orders. Her scrubs always looked a little too crisp, her stethoscope a little too new. To the hardened veterans of St. Jude's, she was fresh meat. They called her Mouse. The undisputed ruler of this chaotic kingdom was Vivian Stroud, a charge nurse with 20 years of experience and a temperament that made rattlesnakes look downright hospitable. Vivian ran the floor with an iron fist and a clipboard she used more like a weapon than an organizational tool. Sawyer. Vivian's voice sliced through the cacophony of groaning patients and beeping monitors. Are you going to stare at that IV bag all night, or are you going to empty the bedpans in Bay 4? The glamorous life of nursing awaits, rookie. Bridget didn't flinch. She simply offered a quiet, "Yes, Vivian," and turned on her heel to walk toward the overflowing sanitation bins. Behind her, she could hear the stifled giggles of the other nurses. It had been like this for 3 weeks. Ever since Bridget had transferred in, the hazing had been relentless. She was given the worst shifts, the most combative patients, and the most menial tasks. She was excluded from the complex trauma cases, relegated to taking temperatures and fetching stale coffee for the attending physicians. The worst offender among the doctors was Dr. Trevor Ashby. Ashby was St. Jude's golden boy, a brilliant, fiercely arrogant trauma surgeon who treated nurses less like colleagues and more like vaguely useful pieces of furniture. Later that evening, the paramedics wheeled in a bloody, screaming construction worker who had taken a nasty fall from a scaffolding. The trauma bay exploded into motion. Ashby was barking orders. Nurses were flying around with shears and gauze, and the metallic tang of blood filled the air. Bridget stood near the doorway, holding a tray of requested intubation equipment, waiting for an opening to hand it off. She watched Ashby work. Her eyes didn't widen at the gore. Instead, they tracked the patient's chest movements, the monitor's jagged lines, and the subtle discoloration spreading across the man's left flank. "His blood pressure is tanking, Dr. Ashby," Vivian called out, her voice tight with rising panic. 70/40, and dropping. "Pump him full of fluids. Hang 2 units of O-neg. He's bleeding out somewhere," Ashby shouted, his hands deep in the man's lacerated abdomen, searching for the source. "Where is the damn bleeder?" Bridget stepped forward, her voice low but piercing enough to cut through the noise. "It's not in his abdomen, doctor. Look at the bruising on his flank, and the paradoxical movement of his chest. He's got a massive retroperitoneal bleed and a tension pneumothorax. If you push more fluids without releasing the pressure in his chest, he'll code." The entire room froze. The only sound was the frantic, high-pitched beeping of the heart monitor. Ashby slowly turned his head, his face a mask of absolute fury. "Excuse me?" Ashby hissed, his eyes locking onto Bridget. "Did the glorified bedpan cleaner just try to diagnose a multi-system trauma?" "I'm just observing the symptoms, doctor," Bridget said, keeping her voice incredibly even, though her knuckles were white as she gripped the metal tray. "The tracheal deviation is starting. He needs a chest tube right now, or get out." Ashby snarled. "Get out of my trauma bay, Sawyer, before I have you written up for insubordination and endangering a patient." Vivian physically shoved Bridget backward out the swinging doors. "You heard him. Go restock the supply closet. Now." Bridget backed away, her face unreadable. She walked down the sterile hallway, the sounds of the frantic resuscitation fading behind her. She didn't cry. She didn't shake. Instead, she slipped into the deserted staff locker room, sat heavily on the wooden bench, and closed her eyes. She took a long, deep breath in through the nose for 4 seconds, held for 4, out through the mouth for 4, a tactical breathing technique. Slowly, she unbuttoned the top of her scrub top, reaching in to pull out a silver chain that rested heavy against her collarbone. Dangling from the chain were 2 battered, black metal dog tags. The metal was scratched and worn, completely at odds with her naive rookie persona. She rubbed her thumb over the embossed lettering, feeling the familiar ridges of her own name, her blood type, and the insignia of the United States Navy Fleet Marine Force. She let out a slow exhale, tucking the tags away. She remembered the scorching sands of Kandahar, the deafening roar of incoming mortar fire, and the slick, terrifying heat of a mass casualty extraction in the dark. Compared to that, Trevor Ashby's tantrums were nothing but white noise. But she had promised herself a quiet life. She had promised herself that the war was over. She just had to put her head down, take the abuse, and blend in. If only St. Jude's knew how fragile their peace really was. 4 weeks into Bridget's tenure at St. Jude's, the city of Seattle was swallowed by the worst winter storm it had seen in 3 decades. It started as a heavy sleet in the afternoon, but by 7 p.m., a massive front had stalled over the Pacific Northwest, dumping inches of freezing rain and heavy snow by the hour. The temperature plummeted, roads turned into sheets of black ice, power lines snapped under the weight of the freeze, plunging entire city blocks into darkness. Inside the ER, the atmosphere was suffocatingly tense. The hospital had switched to backup generators, casting a sickly, dim, yellowish glow over the hallways. Half the night shift hadn't been able to make it in due to the road closures, leaving the floor critically understaffed. Vivian was at the nurse's station, furiously tapping a pen against her clipboard, the picture of fraying nerves. "We have 5 ambulances diverted here because Mercy Hospital lost their generator." "Where is Dr. Ashby?" "He's in Bay 2 with a cardiac arrest," another nurse replied, looking utterly exhausted. Bridget was quietly moving between the beds in the overflow hallway, adjusting blankets, checking vitals, and doing the invisible work that kept the patient stable. She noticed Vivian shooting her glaring looks, but she ignored them. The storm outside was howling, throwing violently frozen water against the reinforced glass of the ambulance bay doors. Then the emergency radio at the nurse's station crackled to life. It wasn't the usual dispatch tone. It was a chaotic, overlapping mess of screaming voices and static. "Dispatch, this is Medic 4. We have a multi-vehicle pileup on the I-5 bridge. A commercial tanker carrying anhydrous ammonia has ruptured. Repeat, chemical rupture and mass casualties. We need every available unit." The blood drained from Vivian's face. A chemical spill combined with a blizzard and a multi-car pileup was a nightmare scenario. "Oh my God," she whispered. Within 20 minutes, hell arrived at St. Jude's. The ambulance bay doors blew open, letting in a swirl of freezing wind and snow. Paramedics rushed in, covered in frost and soot, wheeling in stretchers loaded with bloodied, coughing, and screaming patients. The smell of copper and sharp, toxic ammonia instantly flooded the ER. "Chemical burns to the face and chest," paramedic Nate Curtis shouted over the din, pushing a gurney holding a young woman gasping for air. "She's going into anaphylactic shock. Airway is swelling shut. Put her in Bay 3. "Ah!" Vivian screamed, completely losing her composure, as 4 more stretchers rolled in behind Nate. "We don't have enough beds. Somebody page Ashby. Page everyone." Chaos took over. The delicate, organized hierarchy of the hospital shattered under the sheer volume of the trauma. Ashby emerged from Bay 2, covered in sweat, his eyes wide as he saw the sea of dying patients. For the first time, the hotshot surgeon looked terrified. He didn't know where to start. "Dr. Ashby, she needs an airway," Nate yelled, struggling to hold the thrashing, choking woman down. Ashby rushed over, grabbing a laryngoscope. His hands, usually so steady, were visibly shaking. He tried to insert the tube, but the woman's throat was too swollen from the chemical burns. "I can't get it in. The vocal cords are completely obscured." He panicked, pulling the instrument back. "Her sats are dropping to 60%. Move." The voice was cold, sharp, and cut through the screaming like a steel blade. Ashby blinked, looking up. It was Bridget, but she looked entirely different. The timid, eyes downcast mouse was gone. Her posture was straight, her jaw locked, and her eyes held a terrifying, absolute authority. "Sawyer, back off." "She's dying!" Ashby yelled. Bridget didn't argue. She stepped forward, physically hip-checking the senior surgeon out of the way with a sudden, shocking display of strength. Before Ashby could even protest, Bridget had already snatched a scalpel from the nearby surgical tray. "What the hell are you doing?" Vivian shrieked from the doorway. "Patient has a grade 4 airway occlusion, attempting a cricothyrotomy," Bridget announced to the room, her voice devoid of panic, operating on pure muscle memory. She didn't wait for permission. With a fluid, blindingly fast motion, she made a precise vertical incision over the woman's cricothyroid membrane, popped through the cartilage, and inserted a tracheostomy tube. She attached the bag valve mask and gave it a squeeze. The woman's chest immediately rose. "Airway secured." "Sats are climbing," Bridget said flatly, not looking at the stunned faces of Ashby and Vivian. She turned to Nate. "Tape it down. Get her on a propofol drip." Ashby was speechless, staring at the perfectly executed emergency surgical airway, a procedure most seasoned surgeons sweated over. How did you—" Bridget ignored him, wiping the blood from her gloves. Her ears had tuned out the hospital noises and tuned into a different frequency, the war zone frequency. She turned to the center of the room, raising her voice to a commanding bark that carried over the chaos. "Listen up. We're in a mass casualty protocol. Vivian, stop panicking and establish a tricolor triage system at the doors. Tag them red, yellow, green. Black tags go to the morgue overflow. Do not waste resources on pulseless patients. Ashby, you're on reds only. Move." The staff stared at her, paralyzed by the sudden shift in power. "I said move," Bridget roared, a terrifying drill instructor boom that shook the dust off the ceiling tiles. They moved. Intimidated and shocked, the ER staff instinctively fell in line behind the young nurse. For the next 2 hours, Bridget orchestrated the emergency room like a battlefield commander. She stabilized crushed limbs, directed nurses to administer counteragents to the ammonia burns, and managed the flow of bodies with a ruthless, mathematical efficiency. She was a machine, anticipating crashes before they happened, moving with a dark, terrifying grace. Just as they were finally getting the floor under control, the lights flickered and died completely. The backup generator had failed. The ER was plunged into near-total darkness, illuminated only by the frantic beams of flashlights and the glow of battery-powered heart monitors. Panic threatened to rise again. "Keep working. Use your phone lights," Bridget ordered. Then a new sound began to bleed through the howling storm outside. It started as a low, rhythmic vibration that rattled the medical instruments on their metal trays. It grew louder, a heavy, concussive thwack, thwack, thwack that seemed to vibrate in everyone's chest cavities. "What is that?" Vivian whispered, looking toward the ceiling. "Helicopter," Nate Curtis said, frowning. "But life flight is grounded. The weather is too severe. Nothing civilian can fly in this." The concussive roar grew deafening, drowning out the wind. The reinforced windows of the ER bowed inward from the incredible downdraft. Outside, through the swirling blizzard, 2 blindingly bright searchlights cut through the dark, illuminating the hospital's snow-covered helipad. It wasn't a sleek civilian medevac. It was a massive, matte gray Sikorsky MH-60S Seahawk, heavily modified, with a United States Navy insignia barely visible through the driving snow. The heavy doors of the ER blew open again. 3 men stepped in. They weren't medics. They were wearing snow-dusted tactical gear, heavy plate carriers, and carrying sidearms. The man in the lead, a towering figure with silver hair and the silver eagle of a Navy captain on his collar, scanned the chaotic dark room. Vivian stepped forward, trembling. "Sir, this is a restricted area. We are in the middle of a—" The captain ignored her completely. He raised a heavy encrypted radio to his mouth, speaking over the noise of the idling chopper outside. St. Jude secured. I need eyes on Chief Petty Officer Sawyer. Now. The ER of St. Jude Memorial was suspended in a suffocating, frozen silence. The only sounds were the rhythmic, concussive thumping of the MH-60S Seahawk outside and the erratic beeping of battery-powered heart monitors. Every eye in the dimly lit trauma center was glued to the towering Navy captain and the heavily armed tactical team standing in the doorway. Vivian, clutching her clipboard to her chest like a flimsy shield, stepped forward, her voice trembling. Captain, I don't care who you are. This is a restricted medical area. We are in the middle of a mass casualty event. You need to leave. Captain Dominic Wells didn't even blink. He reached into his tactical vest, pulled out a heavy leather-bound credential case, and snapped it open. The insignia of the Naval Special Warfare Command caught the beam of a paramedic's flashlight. I am Captain Wells, United States Navy, and I am not asking for permission, ma'am. His voice was a deep, gravelly baritone that brokered absolutely zero argument. I have a critically wounded man outside in that bird, and I am here for Chief Petty Officer Sawyer. If you do not point her out to me in the next 5 seconds, my men will tear this hospital apart looking for her. Dr. Trevor Ashby, recovering from his shock, puffed out his chest and marched toward the entrance. Listen here, Captain. There is no chief here. We have a junior nurse named Sawyer, but she is entirely unqualified to handle whatever military crisis you brought to my doorstep. She's a glorified bedpan cleaner who almost got fired tonight. Now, if you have a patient, bring them in and I will treat them. Wells looked at Ashby as if the surgeon were a particularly annoying insect buzzing near his ear. Doctor, if you touch my man, you will likely kill him. I need the specialist. From the shadows of Bay 3, where she had just secured the chemical burn victim's airway, Bridget stepped forward into the narrow beam of tactical light. She wiped the blood from her hands with a sterile towel and let it drop to the floor. Captain Wells, Bridget called out, her voice entirely stripped of the soft, timid cadence she had used for the past month. It was sharp, authoritative, and deeply resonant. Wells turned, his rigid posture relaxing just a fraction as he spotted her. He snapped a crisp, razor-sharp salute. Chief Sawyer, thank God we found you. The entire ER staff gasped. Nate Curtis nearly dropped the IV bag he was holding. Vivian's jaw went completely slack. The mouse was being saluted by a Navy captain? Bridget didn't return the salute. She was out of uniform, but she gave a curt nod. I'm off active duty, Captain. Just Bridget now. What are you doing in Seattle? The weather grounded every bird in the state. We flew under the radar, literally. Wells said, stepping closer. We were transporting Commander Elias Frost from Bangor Submarine Base to a secure briefing. The convoy hit the black ice on the I-5 bridge right when the pileup happened. The transport rolled 3 times. The commander is severely compromised. Bridget's eyes narrowed, her mind instantly shifting gears. What are his injuries? Blunt force trauma to the chest, massive internal hemorrhaging. Shrapnel from the vehicle chassis penetrated the pericardium. He's going into cardiac tamponade, but the shrapnel is acting as a plug. The moment it shifts, he bleeds out. Madigan Army Medical Center is totally inaccessible due to the storm. We tracked your civilian employment records. You're the only Special Operations Independent Duty Corpsman in a 50-mile radius who has successfully performed an emergency clamshell thoracotomy in a non-sterile field. Ashby let out a loud, incredulous scoff. A thoracotomy? You want a nurse to crack open a man's chest in a dark room? That is a highly complex cardiothoracic surgical procedure. I am the chief resident of trauma here, and I forbid it. It's malpractice. Captain Wells stepped directly into Ashby's personal space, towering over the surgeon. Doctor, this nurse is a highly decorated Fleet Marine Force Soid TC. She holds the Silver Star for keeping 12 Marines alive in a collapsed, burning bunker in Helmand Province for 2 days, with nothing but a field kit and a combat knife. She has performed more field surgeries under hostile fire than you have performed in your pristine, climate-controlled operating rooms. Now back away, before I have my men restrain you. Ashby visibly paled, shrinking back as the two tactical operators behind Wells rested their hands meaningfully on their holstered sidearms. "Bring him in, Captain," Bridget ordered, taking complete command of the room. She turned to the stunned ER staff. "Nate, clear Bay 1. I need 2 massive transfusion protocols ready to go. Vivian, stop standing there with your mouth open and get me a crash cart, an open chest tray, a rib spreader, and every flashlight you can find." I can't take orders from you," Vivian stammered, clinging to her fading hierarchy. Bridget stepped up to the charge nurse, her eyes burning with a cold, terrifying intensity. "You will do exactly as I say, Vivian, or I will personally ensure the medical board reviews your triage decisions from earlier tonight." "Move." Vivian scurried away, terrified. Within moments, the tactical team wheeled in Commander Frost. The man was ashen, unconscious, and his blood pressure was practically non-existent. "He's crashing," Bridget said, palpating his chest. "No radial pulse. Jugular veins are distended. The tamponade is choking his heart. We have to open him up right now." She looked across the gurney at Ashby, who was standing frozen in the corner. "Ashby, put some gloves on." "Me?" Ashby stammered. "Yes, you. You wanted to be a hotshot trauma surgeon? Let's see if you can follow directions. Get over here and hold the retractors. And if your hands shake, I'll break your fingers. Let's go." The emergency room became a makeshift theater of war. 6 paramedics stood in a circle around the bed, holding high-powered flashlights, casting long, dramatic shadows against the walls. Bridget stood at the head of the table, a scalpel gripped tightly in her hand. There was no hesitation, no fear. The mouse was dead. The warrior had awakened. "Betadine," she snapped. A terrified nurse poured the antiseptic over the commander's chest. With a swift, brutally precise motion, Bridget made the bilateral incision across the man's chest. Ashby, standing opposite her, watched in horrified awe. The speed, the anatomical perfection of the cut. It was flawless. "Rib spreaders," Bridget demanded. Ashby fumbled, handing them over. She inserted the heavy metal device and cranked it open, exposing the heart. "There's the shrapnel," Bridget murmured, blood pooling rapidly in the chest cavity. "It's pierced the right ventricle. Ashby, I need you to place your finger exactly here." She pointed to a crucial artery. "Apply pressure. Do not let up, or he dies." Ashby, sweating profusely, reached in. His arrogance was completely gone, replaced by the crushing realization that he was totally out of his depth. He was taking orders from the woman he had belittled for a month, and he knew with absolute certainty that she was infinitely better at this than he would ever be. "I have the shrapnel," Bridget announced. "On my mark, I pull it, and I need the 3-0 Prolene suture ready. 3, 2, 1, mark." She pulled the jagged metal free. A geyser of dark blood erupted, splashing across her scrubs and Ashby's face. Ashby flinched, but Bridget didn't blink. With lightning-fast hands, she cross-clamped the laceration, threading the needle through the beating, slippery muscle of the heart, tying off the bleed with mechanical efficiency. "Suction," she ordered. The blood cleared. The heart, freed from the pressure, began to pump vigorously. "Pressure is normalizing," Paramedic Nate called out, a massive grin breaking across his soot-stained face. "Heart rate is stabilizing at 80 beats per minute." Bridget let out a long, slow breath, stepping back from the table. She looked at Ashby, who was staring at his blood-soaked hands, trembling uncontrollably. "Good job holding the retractor, doctor," she said, her voice dripping with ice-cold dismissal. "You can go wash up now. The adults will take it from here." Ashby swallowed hard, humiliated, and backed out of the trauma bay without a word. By 6 a.m., the massive winter storm finally broke. The howling winds died down, and the first pale rays of morning sunlight hit the frosted windows of the ER. Suddenly, the overhead fluorescent lights flickered and buzzed back to life. The city's power grid had been restored. The ER looked like a battlefield, but every patient who had come through the doors was stabilized. At the nurses' station, Dr. Bertram Walcott, the chief of medicine, was standing with Captain Wells. Walcott had fought his way through the snowdrifts to get to the hospital, only to find his ER completely transformed. Bridget walked out of the locker room. She had changed out of her blood-soaked scrubs into a clean pair of navy blue fatigues she kept in her locker, her dog tags resting openly against her chest. Wolcott looked at her, then turned to Vivian and Ashby, who were standing off to the side, looking pale and defeated. "Captain Wells has just briefed me on the events of last night," Wolcott said, his voice echoing in the quiet ER. He fixed a furious glare on the charge nurse and the hotshot surgeon. "He informed me how you two nearly killed a chemical burn victim due to panic and incompetence. He also informed me that you have spent the last month hazing and undermining one of the most decorated medical professionals this state has ever seen." Vivian opened her mouth to speak, but the words died in her throat. "Dr. Ashby," Wolcott continued, his tone lethal, "you are suspended from surgical duties, effective immediately, pending a full review of your conduct and your failure to manage a mass casualty event. And Vivian, pack your locker. You are fired." Vivian let out a choked sob. "Dr. Wolcott, please, get out of my emergency room." Wolcott snapped. As the two disgraced bullies walked away, stripped of their power and their pride, Captain Wells walked up to Bridget. He extended his hand. "The commander is going to make it, Chief. The medevac is fueled up. We're transferring him to Madigan now. The Navy owes you a debt." Bridget shook his hand firmly. "Just doing my job, Captain. If you ever get tired of civilian life," Wells smiled faintly, "there's a bunk waiting for you at Coronado." "I'll keep it in mind," Bridget replied. As the tactical team wheeled the stabilized commander out to the waiting helicopter, the remaining ER staff looked at Bridget. The giggles and the mocking whispers were gone forever. In their place was absolute, unwavering respect. Bridget Sawyer wasn't the mouse anymore. She was the apex predator of the St. Jude emergency room, and she had finally claimed her territory. If you enjoyed this dramatic medical story of hidden strength and ultimate justice, hit that like button and share it with someone who'd love it. Don't forget to subscribe to Beyond the Silence Tales for more thrilling, real-life-inspired audio dramas.
Hi, I'm Gwyneth Wynne, the owner and manager of Beyond the Silence Tales. They called her Mouse and mocked her for a month, until a Navy helicopter landed outside the ER and a captain demanded her by name. I'd really love to know what you think of this one. How did it make you feel? What stuck with me was how much Bridget was willing to absorb quietly, without ever once trying to prove herself. She wasn't hiding out of weakness. She just wasn't interested in earning respect from people who'd already decided not to give it. Which moment hit you hardest? Have you ever watched someone go from overlooked to unforgettable in a single night? I'd love to hear your thoughts in the comments. And if this story kept you hooked, feel free to like or subscribe for more from Beyond the Silence Tales.